There's a huge problem in our society, which is the Ozempic craze. You have to have
absolutely.
the right amount of protein, more than you think, about a gram per pound. We'll talk about that per day. And you need to focus on resistance training if you're going to be on those drugs.
You can lose 20 to 30% of that in muscle.
Well, in Ozempic, I think it's about
higher.
40 or 50%
It can be
of the
40
weight.
to 50, absolutely.
So 50% of the weight you're losing is muscle, which is a disaster.
And that is a disaster.
I'm actually going to challenge his statements as misinformation and fear-mongering. Medical studies do show that a small percentage of people lost at most 40% of their weight as lean mass. And this wasn't just muscle mass. It included water, connective tissue, bone, and the weight of our internal organs. Dr. Hyman's statements are flat out wrong. Other studies show that treating the right people with Ozempic or other GLP-1 agonist medications actually reduce the fatty nature of our muscles and help improve the muscle quality. In my practice, where we counsel on diet and exercise, we have seen muscle mass loss at around 10% and even less of total weight loss. Our patients are having great success, including those where nothing else has worked. We are healthcare providers. We need to be giving accurate information to everybody on how to address their most difficult problems. Diabetes is a huge public health crisis. Almost 40 million people are affected, and many more are developing it every day. How would it be to prevent this from happening? Prior to the GLP-1 medications, our ability to help patients control their diabetes was so much more limited, and many more people had high levels, despite their best efforts at managing their diet and exercising. My patients' levels now are so much better than they were just 10 years ago. There's so much more here. I'll be posting much more on how obesity and diabetes damages lives and how we can combat this with diet, exercise, and the wise use of medication. Don't fall prey to the extreme narratives that exaggerate and twist the facts. Verify those numbers. There's so many people out there that need a combination of every treatment to be successful. Stay tuned. I'll be putting together a detailed analysis of this data so you can decide for yourself.